Hi everyone, Dr. Chiam here from Ensoul Medical. So in the earlier series of videos for facial rejuvenation, we talked about pigmentation as part of the overall facial rejuvenation process, and we focused on a variety of different pigmentary disorders that we see in the clinic. Right now I'd like to zoom into one particular condition, pigmentary condition that we see in the clinic, and I would say this is probably the single commonest condition we see in the clinic, and that is melasma. So melasma is a multifactorial skin disease. It is complex, and that is why when we approach melasma, it is often important that we have a good strategy to tackle melasma. So what are the causes of melasma? The single most important cause of melasma is genetics. So everybody who has melasma has probably got it imprinted in their genetics to have melasma. So patients who have melasma tend to find that it runs in the family. Their siblings or their parents may have varying degrees of melasma. But there are some factors that would make melasma worse than it is. And these factors include sun exposure and sun damage to the skin. Hormones. Typically in ladies, it would be because of pregnancy or the pill, which is oral contraceptive pills. Melasma is very often known as the mask of pregnancy, and very often we find that ladies after pregnancy and childbirth start to manifest the first signs of melasma. The last factor that can worsen melasma are actually treatments. So this is what we call iatrogenic melasma, which is brought on by certain treatments such as chemical peels, for example, very strong peels, or even treatments such as microneedling. So these are some factors that could make somebody who is genetically programmed to have melasma manifest the melasma earlier or manifest it in a worse fashion. So as we mentioned, melasma cannot really be cured, that we don't have a known cure for it. It can only be controlled, and very often, even after we lighten the melasma, it tends to come back. And how fast or how bad it comes back very often depends on your genetic predisposition, as well as the factors I mentioned earlier. So my strategy for treating and controlling melasma involves a four-pronged approach. So the 4 steps include reduction of production of pigmentation by pigment cells. Second step involves reduction of transfer of pigment from the pigment cells to the skin cells. Okay, the third important step is control of hypervascularity or excessive blood vessels underneath the skin. And the last part involves increasing and speeding up the removal of pigments by the skin. So to reduce the production of pigments by the pigment cells, we often use products. In general, we can divide products into 2 main categories. The first category is over-the-counter products as well as medical-grade products. So over-the-counter products often contain a mixture of different ingredients to help to slow down the production of pigments by our pigment cells. So some of these ingredients include retinol, alpha-arbutin. Some have gentle peels in it to speed up the skin cell turnover, and some other herbal additives such as licorice or witch hazel. These products help to slow down the production of pigmentation, but because it does not speed up the removal of pigments by the skin, it tends to work very, very slowly. We do have medical grade products and creams that we prescribe to patients with melasma. So some of these creams include hydroquinone, and the newer player in the market is this compound called cysteamine. So these have been used by doctors for patients as the first line treatment for melasma.